one thing I did want to ask too, because I did ask social workers as well. So what's the difference between social work and psychology? Because it seems that you both have therapy sessions where you speak to people and help them with their issues or whatever they may have to kind of help their life, to make their life better, right? Or make better decisions. So what would be the difference between you two?
Yeah, I'll tell you like this. It really will depend on their
license
job. It could depend on their license, because I think social workers have a couple of licenses.
Yeah, they have different licenses.
But we have different privileges as well. Psychiatrists are trained in medicine, right? Like they go to medical school. So the vast majority of psychiatrists only prescribe medicine. There are a handful here and there in the country that do therapy as well. There's a good amount of them that do therapy in DC, but most just do medicine and aren't trained in therapy at all.
So then what does a psychiatrist do?
They're able to prescribe you,
so,
but based off of what?
Like Xanax and shit like that.
Yeah, well, they'll do an assessment.
Oh,
right?
okay, so we'll have to at least talk to you.
Yes, they will do talk,
okay.
but they'll do like an intake and assessment of your history, like understanding your symptoms. They're very symptom and diagnostic focused
for the sole purpose of giving you medicine, not helping you through your.
So for like Adderall, like Xanax, like your antidepressants. Anti-anxiety medications. Right. That's what a psychiatrist is for. But so a psychologist, we don't have medication privileges, right? But we're very trained in therapy. I'm also trained in psychological assessment, like the Rorschach. And so we can do both of those.
Everyone wants to be a penis. And you want to fuck your mom. Oh, okay, thanks.
He prescribed cocaine at one point, but he also had some
on that shit. So tell me about your day.
Who is this we're talking about?
Freud. Yeah.
Freud was rolling.
He also had some really useful things.
Yes, he did, of course.
I mean, the laws was different back then.
The laws was different. They didn't know much about cocaine back then, that's for sure.
Cocaine.
Medicine.
It's like, this would cure depression. No, it didn't.
No, it didn't. For 15 minutes. And then you had a cure for depression again, another 15 minutes later.
They should have kept cycling through. There's some good ones out there.
Oh my gosh.
So back to what you were saying before.
Then social workers, they're trained in therapy, but they also are really they're also trained in kind of like a community mental health, where they'll look up referrals and resources and programs, for people to get into, right? Housing situations, right? They're more of a kind of like hands-on and getting people connected to certain things that they might need given their situation. So for example, on an inpatient ward, right, they may handle all of the referrals, like all of the follow-up treatment care, and making sure that the family is in touch with the treatment team, and while also doing some therapy, right, and meeting with them and checking up on their treatment plan. So they're more of like, they do a lot of case management, they will do some therapy, but also they'll manage programs to get people connected to programs and referrals as well.